Commissioner Baidoon has requested an excuse. Commissioner Anderson,
Here.
Commissioner Colleen,
Right here.
Chair Baker McCormick.
Here.
You have a quorum present.
Next item.
B, Chairwoman's remarks.
I have none today. Next item.
C, approval of the July 2023, the August 8th, 2023 meeting minutes.
There a motion?
Approval, Madam Chair.
It's been moved and supported by Colleen and Mareki. All those in favor? Can use your tablet too. Motion passed. Next item.
D, unfinished business. There is none listed.
Next item.
Moving to E, new business. Going to the addenda, item 2. Reporting notification of an emergency procurement report for purchase order terms and conditions with Charmtex Inc. for dry goods and supplies, including but not limited to jail supplies and personal hygiene products for an as-needed basis for the juvenile detention facility.
All right. What do we have?
Dr. Abdul Al-Sayed, Director, Health Officer, Department of Health, Human and Veteran Services.
Good afternoon.
Good afternoon.
All right, can you talk to us a little bit about this contract for jail supplies and what does that look like? What type of supplies and
It was a standing order for basic dry goods for the jail facility when the public health emergency in the JDF was called. One of the big challenges was assuring regular access to the basic goods that they needed in the facility. And so we pursued a standing order that would allow JDF to purchase the things it needed to take care of the youth.
it didn't really outline, or at least I didn't see what those exact goods were. What are they? I mean, dry goods and just personal hygiene products.
So youth in the facility will use a personal hygiene kit that they're given every day upon a shower. And so you think about the basic things that you use: deodorant, toothpaste, toothbrushes. Dry goods include everything from clothing to drawers to sheeting to towels.
Okay.
And I cannot list you exactly the set of goods.
Mhm.
I could furnish that if you're interested.
Yes, I am.
Sure.
And a list of how many of those things, how many sheets, how many, I don't know, towels, whatever the items are. I'd be interested in how many we're purchasing.
So importantly, this is a standing order. So when it's on an as needed basis.
Okay.
So it's not really a how many question. It's more as many as you need kind of question. Remember, we were in the setting of the emergency.
Mhm.
We were overcrowded, understaffed, and undersupplied. And so we wanted to make sure that folks had all the supplies they needed. So there's never a circumstance where a kid didn't have a pair of underwear, for example, or a hygiene kit when they took a shower.
Okay, so whatever's not used or needed at this time, those dollars are gonna kind of sit there until you need additional items. Is that
I don't foresee a world where we don't need these things.
right?
And
Okay.
they would sit here, they're warehoused until they were used.
Okay, great. Any questions from commissioners? No, all right. We will receive, yeah. Mhm. Right. Okay. All those in, is it supported? Okay, it's been moved and supported. All those in favor, please vote on your tablets.
Motion carried.
Next item, thank you.
Item 3, requesting commission approval of the appointment of Dr. Avani Sheth to the positions of Chief Medical Officer and Division Director of Clinical Care Services for Health, Human and Veteran Services Department.
All right,
Dr. Abdul El Sayed, Director of Health, Human Veteran Services. Honored to present Dr. Avni Sheth for the role of Chief Medical Officer and Director of Clinical Care Services in the department. Before I present Dr. Sheth, I just want to offer a perspective on this role. Dr. Sheth should be well known to everyone here. She has served in the role of Medical Director, Health Officer, came to the county in the midst of the COVID-19 pandemic, was actually awarded one of the healthcare heroes of 2021 for her work. This appointment is more about a change in a role rather than an individual. Under the reorganization that Commission previously approved, we sought to standardize our approach to clinical services by bringing all of the units where we are providing clinical care under the direction of the county's chief medical officer. This is a recognition of the change of the role of medical director, which is what this used to be called. Direct department, which is clinical care services, and to serve as the lead medical voice, clinical voice in the department. And so given that she is a division director, we are bringing her up for approval. So Dr. Sheth is someone who, as I said, needs no introduction to this commission. She is a board certified a family practice physician. She holds a medical degree from the University of Michigan, did her family medicine residency and chief residency at Columbia. She has an MPH from the University of Washington and undergrad from the illustrious University of Michigan, go Blue. She, prior to her time here, she was the chief medical officer for NSO Neighborhood Services Organization. And before that, she oversaw a number of programs at Cook County's Department of Health in Illinois. And so we feel like she is well poised for this role. I feel extremely confident in her abilities to serve. And then finally, I just want to describe some of how the role will change beyond simply being the chief clinical voice for the county and working within a broad Department of Public Health. She'll be overseeing a portfolio which includes the county's FQHCs, all of our work in behavioral health, as well as the clinical features of what used to be the public health department, division. And so we feel like she's well positioned for this role. Unfortunately, she would have been here today. She had a pre-planned vacation. She is probably on an airplane over some southern part of the United States, hopefully to better weather, although the weather today is lovely. So I can try and answer any questions for you.
All right, any questions from commissioners? Yeah, we're very well aware of who Dr. Sheth is, and she's doing a wonderful job in her current capacity here with Wayne County. So I think we're good. And we'll take the next item then. Yeah, we'll take them together since she's not here, so.
Item 4, requesting commission approval of the appointment of Ebony McCann to the position of Director of the Transition Services Division for Health, Human and Veteran Services Department.
Good afternoon.
Good afternoon.
Carolyn Imo, Deputy Director and Chief Health Equity Officer for the Department of Health, Human and Veteran Services. And I am here in honor and excited on behalf of the CEO, Warren C. Evans, to request the appointment of Ms. Ebony McCann for the position as Division Director of our Transitional Services Division for the Department of Health, Human and Veteran Services. Ms. McCann has served this county for 18 years, starting off with our juvenile detention facility. And she currently serves in the role as administrator for our Adult Community Corrections Division over the past 5 years. She manages and she serves on the Community Correction Advisory Board and has been instrumental in each year presenting and completing the annual comprehensive plan for the Michigan Department of Corrections. So with your approval of Ms. McCain, she will then head and lead our division of transitional services, where we will have our jail health area, as well as adult community correction. With her extensive background in criminal justice, we are hoping to find better integration and from the continuum of beginning with jail health, as well as leading into community correction and placing our residents in the care and the support services that they deserve. So with that said, I would turn it over to Ms. McCain to share her background and to just present to you.
Good afternoon. Through the chair, a lot of what has been said was already prepared. So I'm going to repeat a lot of some of the things that Ms. Nimmo just shared. It is an honor to sit before you as the Transitional Services Division Director candidate seeking commission approval. I would first like to thank Wayne County Executive Warren C. Evans and the leadership of the Health and Human Veteran Services Department, Dr. Abdul El Sayed and Harold Nimmo, for their confidence in my ability to lead the newly formed Transition Services Division. I would like to thank my family also for being understanding, supportive, and some of my biggest cheerleaders. If I may, I'd like to take this opportunity to formally introduce myself. I was first introduced to Wayne County by my mother, Alzana Smith. I recall my mother's first day of work as a county employee, and she came home and she shredded her Michigan Department of Health and Human Services paperwork and said that as a family, we would no longer rely on the state to provide service or care for our family. Each day or each opportunity I'm able to walk through the halls of a county building, each opportunity I am presented with the opportunity to introduce myself as a county employee, I am reminded of my mother's strength, her resilience, and her courage. My mother remained a Wayne County employee until she unfortunately passed away at the age of 48 from cancer. My professional career with Wayne County began in 2005 at the juvenile detention facility. As a juvenile detention specialist, I learned countless lessons. However, the most beneficial lesson I learned was to be of service. My service-led career continued as case manager for Third Circuit Court Juvenile and Adult Drug Treatment Courts. In 2013, I had the opportunity to serve as the Urban County Drug Court Coordinator in Oakland County. It was my responsibility to ensure that offenders who were charged with drug-related offenses were presented with viable treatment options in lieu of a prison sentence. Since 2017, I've had the privilege to serve as the Wayne County Adult Community Corrections Administrator, as well as the co-chair of the Community Corrections Advisory Board. The work and impact of programming implemented by Community Corrections is evident as we have continually reduced the county's recidivism rate, essentially sending fewer men and women to prison by providing quality behavioral health services. If approved as Transitional Division Director, I am committed to ensuring that as a division, we will continue to provide quality jail health services, community correction services, while fortifying and cultivating community partnerships and relationships that will allow us to address other essential ancillary needs, such as housing, employment, education, and family reunification, and so much more as we work on the whole person to ensure that our returning citizens are equipped with the essential skills and tools necessary to successfully return and navigate throughout our communities. Thank you for your consideration.
Thank you. Thank you. Any commissioners would like to, Commissioner Marecki?
Thank you, Madam Chair. I was looking at the purpose of this division, this new division, and you touched on some of the programs for diversion, and it said administrating community-based alternatives to incarceration. Are you thinking about doing additional programs than what's going on now, or what are your thoughts for the future?
I think as the department is led by Dr. Abdul El Sayed, we have, and he's presented to you a lot of his foresight for the future. I too have planned to implement programming in the near future, but those are all things that will have to be presented and brought before this honorable body before we move forward to
Okay.
move forward on them.
All right, thank you.
Commissioner Vice Chair Khalil.
Thank you, Madam Chair. Good afternoon, Ms. McCain.
Good afternoon.
What would you consider the biggest couple of challenges that you're looking at coming into this job that need your attention?
I've been privileged through the chair. I've been privileged to serve in community corrections, and so I don't foresee any challenges with this population. We know that there are some barriers, specifically at coming out of the pandemic. We need to reignite and reengage our probationers as we are getting them to engage in programming. I pride myself on the relationships that I've built and developed with our community partners. I think for the most part, the challenges will be to ensure that contracts are presented in a timely fashion so that they may be reviewed by this body and other committees so that they can be implemented in ample enough time.
But you don't have like a couple of things like, boy, we need to fix this.
Well, I think that in the past couple of years, we've identified gun violence as a significant issue. Commissioner Chair Baker McCormick, her youth council submitted a proposal or an act in which they identified gun violence as an issue amongst youth. And it continues to be an issue amongst adults. And that is something that we would like to address. We did receive for community corrections funding to implement a gun violence prevention intervention program, which is something that we're still working on to implement. We actually are seeking out vendors to provide HEAT, which is a culturally based cognitive behavioral therapy curriculum that focuses and addresses the needs specifically of Black and Brown men and women. So it addresses the challenges that they faced in their communities. And so it's something that we're considering to implement moving forward. But again, it would require approval.
And that would be in our facility. That's where that would take place, this program.
So it would take place in the community. What we're finding is a lot less or fewer individuals are being sentenced to a jail term. And to ensure that they are getting the most benefit out of program, and we are implementing such programs in the community.
Okay. Does the juvenile detention facility fall under your bailiwick here?
No,
well?
No, it does not.
It does not.
No.
Okay. Jail health. What is the current status of people leaving the jail and getting their medications? What are they leaving the jail with? I mean, this has been a thing that's gone on. There's been some things in the past. So I just want to follow up on this. So when people are leaving the jail and they have medications, what are we giving them as they walk out the door?
So through the chair, I am not currently acting in the role as Transitional Services Division Director, so I can't speak to that directly. I do know that there have been discussions, and I would like to turn it over to Ms. Nemo to speak further.
But it is going to be in your bailiwick.
Yes, it will be.
And she's been getting warmed up, in that area. So one area that we focus on is those with mental health prescription. So with our inmates who are been leaving the jails, we do provide a script for them. We connect with the Detroit Wayne Integrated Health Authority network. And so they are provided a script, and they actually have, can go and fill their scripts before they go home or while they're out. So we are providing prescriptions to them for their medications.
They can fill the script at the jail?
No, they will,
Pharmacy
we have, they can fill it at any pharmacy that, with where they stay or their preferred pharmacy.
Because when we first started this, and they said, oh yeah, we're going to give them scripts when they leave.
Mhm.
There's 2 CVSs in Wayne County they can go to. And then later on, it was they can go to any CVS.
Yes.
are you saying any pharmacy at all now they can go to?
Yes, they
And
can
get
go
it
to,
filled?
yes, and get it filled.
Okay, that's great, because I don't know if we follow up or know if people actually are getting their scripts filled.
We do have a system where we are managing that. We look at the data on a frequent basis, at least monthly, I would say. And just this is an issue nationally, filling scripts. Once it's discharged, we're saying that the numbers nationally is low. So we're thinking and we're discussing strategies to just put in some safeguards to ensure that, you know, they are one, getting their scripts, and two, they're filling their scripts. So we're monitoring that closely.
when the
So
right
that was
people are
one
getting the
reason why we
medication.
expanded the number of pharmacies. However, of course, you know, just thinking through maybe tightening up follow up with them and checking in. But that's something that is a top priority that we've been reviewing and trying to improve the rates of that.
Because we also want to make sure the right people are getting the medication, not somebody else.
Yeah.
So Jail Health, the company we have over there,
NAFCare.
which care?
NAFCare.
Yeah. Where are we at with their contract?
With the NAFCare contract, we have we're in year two. We have 2 more years of the contract. Okay.
So-
And of course, we will be before you soon to take a look at the contract, because we're constantly evaluating our staffing and, resources and whatnot. So
Yeah.
we have a really great relationship with NAFCare, where we talk every day, and evaluation, our metrics are important to make sure that we are meeting those goals and we are responsive to the needs that they are saying, if there's additional resources. So we do plan, just to give you a heads up, to present that contract before you in the next few weeks.
Okay.
But there's 2 years to run.
Yes. We're working on increasing our staffing levels, right? So that we can just have the discipline, the nurses, and what we need to serve, to serve the population more effectively. So
Does our fiscal staff have a comment on this? I saw you.
Yes, through the chair. Actually, the contract that we approved, the commission approved, expires September 30th, 2024. So there's 1 year left with 2 options to renew.
Okay.
Mm.
Okay, with 2 year, 1 year. But you're coming back before us, probably to take one of the options.
yeah, well, we're coming before you very soon to talk about our staffing plan.
Yeah.
Yes, so that the option to renew, that would be later on
Okay.
during this fiscal year.
Because staffing has been an issue. I mean, just like everywhere else.
Mhm.
It's not unique to this company, finding enough nurses and other
Yep.
medical personnel. I hope when you come back to us that you will provide some sort of a report in terms of where you've been with staffing,
Mhm.
and so not just a looking forward kind of thing, we want to, but also just kind of looking backwards. To have a private firm in the jail
Mhm.
delivering healthcare. I want to hear from the public side how well they're doing.
Right.
And is that part of the plan for what you are going to come back to the commission with?
Well, we will be prepared. We have that information.
Yeah.
We live it every day, so we'll be prepared to share that with you.
Well, because in a way I live it every
Mhm.
day myself.
Mhm.
So I'll look forward to that when you come back before us. Thank you. Thank you, Madam Chair.
Thank you, Commissioner. Commissioner Anderson.
Thank you, Madam Chair. I applaud you for, I think what'll be a focus as you assume the new responsibilities. One of those I would assume is finding a way to help decrease the recidivism in the community and also find some way to assist with the reintegration of those that have been jailed to be able to flow back into society in a meaningful way. And one of the things I know when I served on corrections in the state, the temporary housing issue was a big one still. And is that going to be under your bailiwick also to try to help provide those services and the housing for those?
Through the chair, I think transitional services, yes, will encompass all of those ancillary needs, with housing being a significant barrier. And so that's something that we're looking to work with the city of Detroit to collaborate to see how we can move forward, as well as Michigan Department of Corrections to see how we can provide adequate housing and eliminate some of the barriers that our returning citizens face when they attempt to acquire housing. So yes, those are all questions and concerns that will be addressed under my role if appointed.
Thank you. I was going to ask you too about job opportunities and training and things like that. Do you see us expanding into something like that to help provide the necessary training to make them job worthy to employers? And I hope we'll find something to be able to assist in that, because we can't just, when someone walks out the door, expect them to be able to survive and go in the right direction. And I think even another part of that is conflict resolution, try to find a way to work with them to show folks that it's not going to be a good ending unless you know how to resolve issues that you have with others. And I know it's a massive undertaking, and I think you, from everything I know about you, you're going to be up to the challenge, and wish you all the luck.
I appreciate that. If I may, each year, Community Corrections partners with the Michigan Department of Corrections to participate in an annual job fair, which is specific to individuals who've been sentenced and are currently under the supervision of a probation agent or on parole. And so that's the primary population, that's the targeted population. So individuals who have a criminal record, the employers are aware of their criminal history. They are willing to hire them. And so this is something that we pride ourselves on participating in annually, is something that we will continue to participate in and hopefully get some more partners from the community to join us.
Very good. Thank you.
Thank you.
Thank you.
Right. And to that point, working with the probation officers, will you be working with them directly? And will there be, we talked about health, medicine, all of the wraparound services that housing that is needed for inmates once they leave. Is, I guess, your job, will it entail providing all of those wraparound services or coordinating all of those services?
The current job description, or one of the current responsibilities of the Community Corrections Advisory Board, is to provide oversight over the adult probation lease agreements. So that may be where that language came from. So I don't provide supervision over MDOC employees, but we do supervise as a result of the State Assumption Act. We have 5 lease agreements that the county is responsible for providing payment, as well as the supplies for those MDOC agents. Separate from that, I speak with and I collaborate with my counterparts at the Michigan Department of Corrections daily, more frequently than I do county employees, just to address programming and policies and procedures and practices that are being implemented in the court to ensure that the bench is aware of the programs that we have to offer. They are aware of the methods and means in which they can refer probationers to programming. So I speak and collaborate with MDOC on a daily basis. And yes, that is something that I would like to continue to cultivate and nurture moving forward.
Great. Well, I just want to say that I know that you'll do an excellent job. From what I know about you, you're about the business of supporting and helping people. And You're a constituent, which is even better. And I just want to say, from, my good friend, your husband, Al, he wanted me to make sure that you know that if he was here today, if he could be here today, he would be here today for you, because he's so very proud of you. I spoke with him last night via text, and he is just so proud of you and the work that you are doing. And I'm proud of you as well.
Thank you very much.
Right. Commissioner Marecki.
Thank you, Madam Chair, for recognizing me again. This is probably much better process than it was years ago. Before I was a commissioner, I was a city clerk. And occasionally we get people coming in, like after incarceration, that wanted like their birth certificate to get IDs. And we'd really be in a tough spot because you have to have so many different documents, and you have to have two of, so has there been any improvement with clerks with this? Because it would really, you'd feel sorry, but you couldn't give the information sometimes.
Through the chair, that continues to be a barrier. It continues to be something that we're working on. I know prior to COVID, the city of Detroit implemented a municipal ID in which it would assist initially with individuals securing employment, but we are looking to see how we can efficiently ensure that individuals are receiving the adequate documents that they need. And one of those things requires them having a birth certificate. And so how can we streamline that process? How can we help assist, navigate them through procuring those documents? Is something that we speak about daily.
Okay, so you help them in this
Yes.
effort. Okay, great. And this was years ago. So yeah, I know it's a tough one. Thank you.
All right, is there a motion for item 3 and 4?
Yep.
Moved by Commissioner Marecki, supported by Commissioner Colleen. All those in favor? Yes. Motion pass. Next item, congratulations.
Thank you.
Mhm.
Item 5, requesting commission approval of Amendment 1 to a subrecipient agreement for the Detroit Wayne County Health Authority, DBA Authority Health, to continue providing administrative and program services for the Wayne County Catalyst for COVID Response Community Health Literacy and Equity Program.
Good afternoon again.
Good afternoon. Fancy seeing you here.
Your name and title. for the-
Dr. Abdul Al Sayed, Director and Health Officer, Department of Health, Human and Veteran Services.
All right, can you just briefly talk about this item? for us?
Yeah, so Authority Health is a grant subrecipient who is engaged in a federal project, and their role is to help build and sustain a community support network around the Catalyst grant, which this honorable body approved an extension on in our last meeting. And so this is just extending that relationship. There is no difference in the financial arrangement. It simply just extends this out a year to facilitate our efforts here.
Okay, and do we have like any reporting of what has been done so far in the community? Any actual literature, or I'm just trying to figure out what we can put our hands on that this group of collaboration, what they have collaborated on and what they have actually provided as a finished product. So
yeah, our intent is to, in this project, to extend the project outward. The intent was to provide a report at the end of the project. Obviously, we'd want to extend it. And one of the reasons we've tried to extend it is simply because we feel like more time would allow us to better meet the aims of the project.
okay. If there's a way you could bring us something that kind of outlines what is actually being done in the community. There's a lot of organizations, a lot of moving parts, and just would be interested in seeing what that looks like.
Understood.
For me. Thank you. Any questions from Commissioner Killeen?
Thank you, Madam Chair. Afternoon, Doc.
Good afternoon.
What is your idea, your vision for what the community health workers are doing or will do in the future?
So community health workers can be a really great, permit me a metaphor here. They're really great cement between the bricks. You have a lot of institutions that do a lot of things. It's hard to connect people to those institutions. Oftentimes, community health workers are that cement that brings people to those institutions, brings them access to the services those institutions offer. So that's the vision for the role that community health workers under this project fulfill. And it's certainly something I'll tell you that at our department, we're exploring more broadly in terms of outreach. And, you know, I'll be honest, we've been a little bit thin when it comes to outreach and engagement. In the budget that we proposed for fiscal year 24, we include a unit focused specifically on community engagement, which can allow us to reach into the community in a much more robust way. But for the purposes of this grant, community health workers are exactly that. They're intended to be the cement between the bricks to bring people to the institutions and the work that they're doing.
We turn that into what they're doing every day. When they say they're out in the community, are they out knocking doors in particular areas, targeting certain populations? Because certainly it's a lot more than Wayne County in America's healthcare system that has ignored this, right? And I'm intensely interested in community health workers because, you know, as we say, people that need this stuff the most are the hardest to find and can be a little disengaged from social institutions. Either, well, we heard it earlier, right? We're not going to have the state. So on a practical level, what I don't know if there's such a thing as an average day, but can you kind of describe where they're going to be and how they're going to be this mortar?
So usually the way that they work is to connect people who have some entryway into some institution, be it a health institution or not, and then use that connection to connect them to other institutions. So what do I mean by that? It means partnering with a local church, being there on Sunday, and then being able to work with somebody at the local church that means a particular demographic and make sure that they then get connected to all the healthcare institutions that we can connect them to. Or it means that we find somebody at the very tip of the healthcare system, say an emergency room or a clinic, right, for WIC services, and then ask, all right, how can we partner with you to get you access to all of these other services that you are also eligible for? In the case of this project, this is a COVID-oriented, COVID era kind of project. And obviously, we know that the consequences for COVID didn't end with the end of the pandemic emergency, that we are going to face another round of vaccines. We want to make sure people stay connected, but then also all of the foregone healthcare that folks should have gotten during the pandemic that they're not getting. And so in this particular project, Authority Health is working with partner institutions, including civic and religious organizations and community organizations, to get access to folks who may benefit from the services that we collectively offer, and then connecting them across those services.
Yeah, because we're developing community health workers at Authority Health as well. When it comes to emergency rooms, right? Because this way too often are what people fall back on for their health care. I'm going to wait till I can't get out of bed, call 911 and say, I got to go to the emergency room. Do our healthcare community health workers show up at emergency rooms? Do hospitals work with us on that?
So for the scope of this project, no.
Okay.
this is something that we really would like to explore. One of the challenges with the nature of the American healthcare system, and permit me to wax philosophical here for a minute, is that if you do not have any healthcare access at all, the most rational choice for your healthcare is the emergency room, because it is the one single place that cannot turn you away because of a law called EMTALA. If you then get insurance, even if that insurance is Medicaid, which is the most poorest version of insurance you can get, it then behooves you to go anywhere but the emergency room. The hard part, though, is that if you've grown up in a circumstance and come to learn how to use the healthcare the system in a circumstance where you were either did not have health insurance or were health insurance insecure, then you almost always fell back on the emergency room. So even if you do get insurance at that point, you're still likely to go to the emergency room, even though that is the most costly, least efficient, least effective point of care for you. And so there's a lot of re-education inside the healthcare system that ought to happen. And one of the things that we hope to explore is just how do we start thinking about providing that at the point of care, right? You don't need to be at the emergency room. You really ought to go to a primary care clinic or even an urgent care if it truly is urgent. So this is a really helpful use. But for the scope of this project, that's not really the scope we're focused on.
Gotcha. Well, I hope we get there. Like I say, I'm very interested. When you look at all the health data and it applies then to every other aspect of their life, you can't be out sick for a long time and still maintain your job or be sporadic with that, and all the transportation, all of what we know, right? So I hope we're able to expand that a little bit in the future. You also reference health literacy materials in here. Is that around COVID?
Yes.
That's the money here is for COVID.
Yeah.
So you did mention Hamtramck, Melvindale, and other socially vulnerable Wayne County communities. I'm going to put in a little pitch here for the Hmong community. There's a long and troubled history, really, with the Hmong in Washington, D.C., and their participation in the Vietnam War in Laos. And they actually wound up working for the CIA, and the end of the war comes and the United States pulls out, everybody leaves, and the North Vietnamese come over to Laos to the Hmong, go, hey, remember us that you were fighting against? And then they became the boat people. Washington has not fulfilled all the promises that they made, going all the way back to the late 60s, early 70s. So it is a community that the language problems that people have, and just nobody's really addressing it. They're kind of on their own. It's not a huge population, but I'm putting in a little pitch that the population that we do have in the county, if there is something we can do with materials, language and stuff, we need the same thing for voting with that community. So Madam Chair, I'm just putting in a little pitch for that group. Thank you.
Noted and appreciated.
Thank you, Commissioner Killeen. All right. Again, if we could just get a brief report of what these organizations are doing in the community, that would be very helpful to commissioners. Thank you so much. Is there a motion for this? Okay, motion by Commissioner Killeen, supported by Commissioner Marecki. All those in favor, please vote. Any opposed? Motion passed. Next item, please.
Moving back to the agenda, our presentation for new business item 1 has been canceled for the day. Moving to F, such other matters as may be properly submitted before the committee.
We did. Yes, we voted on everything. Okay. All right, next item, please.
F, such other matters as may be properly submitted before the committee.
Are there no other matters? Next item, please.
G, public comments.
Anyone in the audience? Anyone in the audience? No one in the audience? Anyone on Zoom or emails?
No emails were received.
All right, next item, please.
Adjournment.
It's been moved and supported.